The third phase of risk assessment is risk evaluation. Risk evaluation is the comparison of our risk analysis results with our risk criteria in order to make decisions about risk treatment. Risk treatment is simply the plan or action we plan to take related to that risk to make it tolerable. In this image, for example, we have our likelihood and consequences matrix. So you'll see that we have likelihood along the y-axis and consequences along the x-axis. And the gray blob roughly indicates our risk tolerance. Again, precision is not as important as having some defined area of things that we will tolerate and those that we will not. We've plotted two different risks. One with a great deal of uncertainty, both about likelihood and consequences. That's the large red risk in the middle. And then we have another one with well-defined consequences and likelihood that is clearly outside of our risk tolerance area or our risk criteria. The objective of our risk evaluation is to decide what to do about these two risks. And we would evaluate risk treatment options relative to that decision. The risk criteria, combined with our uncertainty and our ratings, means that we have a clear focus for the large risk in the center. We need to take actions to reduce our level of uncertainty if at all possible. In some configurations, this risk might be completely tolerable, and we don't have to spend any valuable resources in terms of budget or time or people in treating the risk if we simply knew it more precisely than we do. So the investments would be best spent to narrow the range of uncertainty along at least likelihood or consequences, if not both, so that the circle is smaller and more manageable. At the end of that process, this risk might be outside our risk tolerance policy, in which case we would need to treat it. However, reducing the uncertainty might also reveal that the risk is actually within our risk tolerance policy and we don't need to spend anything to resolve the risk. The small risk on the right is not small because it's not important. It is small because it has well-defined boundaries in terms of its likelihood and its consequences. We know more about it. But it is clearly outside of our risk tolerance. So the risk evaluation decision is also clear in this case. We have to invest enough time or money or people resources in order to move that risk to the next down below our risk tolerance line and make it an acceptable risk. Notice that the objective of the risk treatment plan is not to remove the risk entirely. It is simply to move it down the likelihood scale or down the consequences scale or both so that it is tolerable. So we don't need to spend so much to eliminate it. We need to make it tolerable, and it clearly is not at this point.